Thank you for the opportunity for this interview. I'm Dr. Kongolo Kalumba. I'm a consultant pediatrician and pediatric hematologist. I practice at Monash Specialist Women and Children here in Melbourne. I'm an Australian from Congolese background, and I came to Australia in 2003 with a contract with Monash Medical Center initially. Initially, I was probably the only African at Monash at that point of time. I think the initial impression I had that people were a bit, seeing an African around, but with time they know you better. So people will look at you first, watching what we are doing, and it takes some time for them to understand that you are a member of the team and capable of doing the job they can do. For anywhere you go, you start learning the system first, how it works, and then from there, I think you adjust yourself as well, and just work hard. Obviously, there are some challenges. First of all, the accent. The accent was my first challenge, as I would say. Whenever we're on the ward round, or I was saying, what are these people talking about? Because I could not pick up for maybe 2 weeks. I could not really pick up very well whatever they were saying. And they could not also understand my accent as well. So that was a kind of reciprocal. But after time, I learned to speak more slowly. So, okay, let me slow down and make sure that they understand what I'm saying. The other challenges was that people looking at us, seeing an African doctor was, sometimes they will come and ask you, have you ever done this procedure before? So this kind of question sometimes is irritating. Then we just, I try to minimize and laugh. I remember when I was supposed to present at Monash, the rate I came, have you ever used PowerPoint before? Then I just laugh. But after time, everyone can accept. They will even forget that you are African, because from Monash I went to work for the Royal Children's Hospital for about 6 years or so. If you look at here, the way their culture, they embrace more the social aspect of it is very important as part of treatment for whatever management of a patient. That's a bit different from like African side, where there is no emphasis on a social background. So the doctor will tend to treat the patient on isolation, compared to here, where they will consider more the social background as well. So getting that multidisciplinary involvement so that the patient care is maximized. That was one of the differences. Like particularly in pediatrics, the standard is not the same, but the the basic principle of medicine remain the same. Yes, absolutely, and I will never stop emphasizing that to young people, basically. So obviously, you have to work more harder, because for you to compete with the let's say the Aussie doctor, here you say if an African doctor have to work three, 4 times more. First of all, this is the aspect of profiling. I think if you came from Africa, so by just seeing you, people think that you're not able to do the job as they can do. So if you do the same level, basically, if there's a position, you're not going to get it. Preferably, they may give the position to just based on, let's looking at your name. If you apply, let's say, for a job, if you say, okay, I'm Kongolo Kalumba and I'm John Smith, the way they will consider the application will be different. Being from Africa is a bit of handicap. We have to recognize that, and we have to work hard. But like here, we have to do again a fellowship. I have to do a fellowship exam again to have my specialty recognized. When you move from one place to another one, you don't think necessarily that they're going to accept your qualification, because every country tries to protect the profession by trying to filter who's coming and not allow anyone to come and practice medicine. So coming from Africa, if you come to Australia, basically your degree will not want to be recognized. So not forget about it. So you have this basically three pathway. One, you can have, if the hospital need you, they call area of need, then they can sponsor you. That's how I came. So Monash needed me at that particular time. So I came, I was supposed to work in a neonatal intensive care. So they needed me that time, so they sponsor my registration of medical board. So that sense, then my degree doesn't matter where I obtained from Congo, because Monash sponsored me. So I was granted registration. So they will look at your CV, your curriculum vitae, and they will see whether you've got the expertise they need. And obviously also they will request from references. So normally you nominate at least 2 references who they can talk to ascertain that you are the person and you have the expertise what they need. Secondly, the other pathway, so you have to do what you call AMC, so is the Australian Medical Council exam. So that pathway, I mean, you do 2 steps. You do the clinicals, and also you do you do your written exam first, and then your clinicals. So once you pass both, then you can be registered with a medical board. Obviously, people struggle a lot. It can be, I don't know what the cause are. It could be probably just not knowing the system, or can be, again, you know, whether the exam is fair for everyone. I'm not sure about that. But obviously, if you pass the exam, if you pass the exam, then obviously you get full registration. People do pass, and different people from all over the country, India or Middle East, and who do the AMC exam and do pass as well. The third one is some people came from a different country, like England, sometimes South Africa. They do come without doing the exam. They are granted a temporary registration. But for an African, I think when I do the exam, I will come in the area of need. I think that's the 2 pathway. Then once we are here, obviously you have to now to do whether you want to go through the GP, general practitioner pathway, which is probably the quickest or the easiest. So most African will go through that pathway, so become a general practitioner and then start working. Or you go through the specialist pathway. Okay, so the specialist pathway can be also difficult. Most people, even is time consuming. Then you have to undergo do the exam through the college, a specific college. So depending on your specialty, and that exam is also a tough exam. Is tough exam. It's also got, most of them will have 2 parts, written and clinicals. And that's what the difference also is from compare like Australia compared to US, because in Australia some of people can be exempted, particularly if you come specialists from a particular country like UK or sometimes of Cape Town. But in the US, for instance, it doesn't matter where you come from, everyone do the same exam. That's fair, but here I think there's that difference. But again, every country got its own regulation. But once you get your fellowship and specialty, then you are treated as anyone else. So you have nothing to worry about. So. That's correct, yes. So I took a specialist pathway because I was already I was pediatrician, so I didn't want to go to another pathway. And then I had to do the exam. So after my fellowship exam, then I wanted to do a subspecialty. So I ended up taking a second specialty, hematology, so which is a blood disease. That is about 4 years. So training, so I have to have laboratory training as well. So in a medical terms, so in hospital beds or in terms of patient care, consultant is the highest level, so you go to. So the hospital has basically a system where there's the doctors have don't have the same expertise. So the younger one will come from school. Basically, we call them interns. So those one is kind of learning process for them. So they'll be attached. They have no right on the patient, or cannot make a decision on the patient. So they have to learn first. So they will basically just help the registrar or the consultant to with writing note and learning. Then that. So after the internship, after 1 year of internship, then they become a resident. So that means they are again in a training kind of pathway. So for those who want to become a general practitioner, so in Australia, for instance, they will have to spend 3 more years of training to become a general practitioner. So they will rotate in different discipline, including pediatrics, obstetric and gynecology, surgery, and internal medicine. But those who are doing a particular specialty, then they will whether go, if you want to do pediatrics, you go to pediatrics. If you want to do internal medicine, you go to internal medicine. For pediatric, for instance, it takes 6 more years to become a pediatrician after you've completed your medical degree. And then the residency, so you take 2-3 years. Well, by the time they are 3 years, they will do the first exam, written exam, and then the clinicals, and then they become a registrar. That means now they're in the middle progressing toward consultancy.